Hi, this is Bandana Lamisani, student number 00388 S 00388 and today I'm going to talk about the pathophysiology and pharmacology of Parkinson's disease. Firstly, we have an introduction about it. Parkinson's disease is a chronic neurological degenerative disorder that predominantly affect the brain, and it affects the motor function of the brain. And since the Parkinson has a huge and crucial role of dopamine, so we're going to discuss about the role of dopamine here. So dopamine is actually the chemical messenger of the brain that helps to control the movement in the body, and it is made in the part of the brain called substantial nigra. And this substantial nigra is found in the region of brain with its midbrain located. And the action of dopamine, the dopamine acts in the basal ganglia, which are the group of structure that helps in movement by ensuring that the right muscle is activated and deactivated at the right time. And following this, also dopamine allowed the brain to send smooth signals for movement by interacting with two major pathways, which are one is direct pathway and another is indirect pathway. So likewise, we're going to discuss about the pathophysiology of Parkinson disease here. So firstly, we're going to discuss about the neurodegenerative in the substantia nigra. Parkinson disease is actually categorized by the loss of dopamine that dopamine producing neurons in the substantial nigra, pars compacta, which is a part of the brain that helps to control the movement of our body. And in the Parkinson disease, those neurons died, and it led to dopamine deficiency in the basal ganglia. And that's why the motor symptoms like tremors, muscles, rigidity, slowness of movement, or bradykinesis develops in the patient. And there's a reference I have given. And also there's another one region for Parkinson disease, and which comes under the pathophysiology of Parkinson disease, and that is Lewy bodies, which is the protein buildup. And the Lewy body, let's discuss about how it works. I mean, why it make the person makes Parkinson disease, what the role of this. And in Parkinson disease, there is the abnormal clumps of protein, which is called Lewy bodies, which is made up of alpha synuclein formed inside the neurons. And when these clumps then damage the normal function of the neurons, and it really make it difficult to function. Lewy body also affects the brain and lead to cognitive decline like mood disorder or other non-motor symptoms of Parkinson's disease. Let's talk about the motor symptoms of Parkinson's disease now. The motor symptoms of Parkinson's disease are: one is tremors. This includes shaking of limbs. This is usually such in one hand. And another is bradykinesis. This includes the slowness of movement, in which the movement will be slow and simple tasks become difficult. And another is rigidity. This includes the stiffness of the muscle, which leads to discomfort and difficulty in moving. And another is postural instability. Patient will have difficulty in balancing, and that's why it leads the patient to fall and injury. And we have another symptoms, which is non-motor of Parkinson disease, non-motor symptoms of Parkinson disease, in which cognitive decline happens as the disease progresses. Patients start to have trouble in thinking and difficult to remember things. Depression and anxiety start to grow up in a patient because patients start to feel anxious, and then that lead to depression. Another is sleep disorder. Patients start to have difficulty in sleeping and eventually stay asleep all day, which lead to other problems in the body too. And another is autonomic dysfunction. The patient, the problem the patient will have problem in digestion, constipation will occur, there will problem in urinary inconsistence, and hypertensive also. Now we're going to talk about the pharmacology of Parkinson disease. So the overview of Parkinson pharmacological treatment. The goal of the treatment is to replace or mimics the dopamine in order to improve the function of the body. The goal of the treatment is to control or manage the motor fluctuation in the body. And the medication classes are described as below. There is levodopa and cardidopa, dopamine agonist, YAMI-OB inhibitors, COMT inhibitors, anticholinergics, amantadine. And mechanism of action of levodopa is levodopa is kind of dopamine precursor. It converted into dopamine in the brain by crossing the blood-brain barrier. It's effective because it helps in reducing motor symptoms like rigidity, tremor, slowness of movement. And it also start to work, and the patient start to feel relief after 30 minutes of administration. We have another medication called dopamine agonist. The examples are pramipexole and ropinirole and reticontine. And the mechanism of action of these are the drugs actually mimics the dopamine by stimulating the dopamine receptor in the brain. It's effective because it relieves the pain from the motor symptoms in the early stage of Parkinson's disease. And the side effect of this medication is nausea, dizziness, sleep disturbance, and disorder like hypersexuality. And we have another medication called YAM-AOB inhibitors. The examples are selegiline, rasagiline. The mechanism of action of this medication is that medication inhibits monoamine oxidase, YAM-AOB, which is an enzyme that breaks down the dopamine in the brain. It is effective because it provides mild relief with the symptoms, and particularly used in the early stage of Parkinson disease, and it also has the neuroprotective effect. The side effect of this medication is insomnia, especially with the selegiline, and nausea and dizziness. And we have another medication called anticholinergics. The examples are benzotropine and then trigehenyl. And the mechanism of action of this medication is it helps in blocking the action of acetylcholine, which is a neurotransmitter that becomes hyperactive due to dopamine deficiency. Effectiveness is because it helps relieve a patient from tremors and rigidity. Side effects are constipation, dry mouth, blurred vision, confusion. And the conclusion is Parkinson's disease is caused by progressive loss of dopamine producing neurons in the substantia nigra. The lack of dopamine in the brain disrupts the control of movement, thus the symptoms like tremor, rigidity, stiffness, slowness of movement occurs. The presence of Lewy bodies and the involvement of other neurotransmitters contribute to the motor and non-motor symptoms of Parkinson's disease. And Parkinson's disease management involves occurs medication aimed to replace dopamine or by mimicking or protecting the effects. And also, each drug has specific roles, benefits, and side effects, requiring personalized treatment plans. Effective Parkinson's disease really needs the combination of effective medication and also long-term management therapy also, which includes occupational therapy, regular exercises, speech therapy. And along with the patient, the family and caregiver has also provided the essential care, which includes therapy session, mental care, mental health services, and etc. So if you have any question, please you can put the question in here. And thank you so much.